Good afternoon, everyone. Good afternoon. Okay, I think, good afternoon, everyone. I know this is kind of busy and the like. My name is Dr. Aziz Issachus. I chair the Department of Informatics and Health Data Science at the University of Miami, Miller School of Medicine. And welcome to this year's Health Innovation Pavilion, where we're going to be talking about our CarePlan innovation. All right. Our CarePlan challenge is, I think, a unique opportunity where the center brings together and showcases the DNA of who the center is. The center really focuses on three core areas. One really is, are you solving for a problem, and are you solving for that problem? What are the technical implementation strategies that you build your solution on? And does your solution actually solve issues such as access? Because it's one thing to build a solution, but if it's not implemented in a way that all people have access to it, then we can't see its full impact. And so this year we had, I think, dozens of entries. So congratulations. It was extremely, extremely hard. We had some amazing judges who will introduce themselves briefly. And we unfortunately could not select all the amazing, fantastic entrants this year. And we had to painfully narrow it to just 3. But before I do, let me just acknowledge our fantastic judges. If you could just quickly say your names and your affiliation, please. Seth, I'll start with ladies first, if that's okay with you. Perfect.
Hello, everybody. I'm Professor Mikos. I'm in the Division of Cardiology at Johns Hopkins Medicine. Happy to be here.
Hello, Tatiana Canzavelli. I'm the founder and CEO of Open Health Network.
Hello, everybody. Seth Martin. I'm a professor, preventive cardiologist at Johns Hopkins. Pleasure to be here.
All right. I'll give a round of applause for them as well, please. So let me show you, I'll walk you through the run of play today. So we will have 3 presentations. As I said, it was very painstaking for us as judges. They were all phenomenal. And so the finalists who I'm about to call should feel extremely, extremely worthy, because it was very tough for us. And so the run of play will be this. We will call whoever the representative is for those companies. They will present their solution to you all in 5 minutes. We will have a lead judge ask some few questions, which, my hope is that they will be shared by you all as well. Those will take about 3 minutes, and then we will go through each. If we have enough time, we may, if my boss, Dr. Dunn, allows me, we may take questions from the general audience. But with that, let us welcome our first finalist, which, you're all our winners. I'm not trying to give everyone a medal, but you're all our winners here. Our first presentation is Porter Health. Congratulations, Porter Health.
Hello? Everyone can hear me?
Yep.
Awesome. I wore the same shirt so no one would get confused. That's the same guy. We'll go to the first slide, please. I don't have a clicker, do I, Rachel? This thing? Yeah. Okay. All right, so I'm here today to talk about Porter Health's Thrive platform. Whoops. It kind of auto-played, is that okay? Okay. So just the green clicker, is that right? Okay. So I'm here to talk about Thrive, our evidence-based CKM platform, cardiovascular, kidney, metabolic. And I'm Tushar Palikar, but I'm here representing all of Porter Health, includes Mike McConnell, Ashu Chauhan, and Christian Martinson, who are out in the crowd here. Maybe, okay. So we're really going to go quickly through the problem, the solution, a demo that's actually been pre-recorded to go really fast, so my voice, but double the speed, and then talk about the potential impact of the solution. So what we're really trying to solve, everyone should be familiar with. There's simply this lack of awareness of underlying risk. Most people don't know exactly what's going on with their cardiovascular, kidney, metabolic health. Most folks are stage 1 or stage 2 in this country on the CKM syndrome, but they don't know that. They haven't checked themselves out. And of course, there's a slew of other problems kind of affiliated with that. Our solution is to try to integrate some of the AHA's evidence-based frameworks like CKM staging, prevent scoring, LE8 scoring, to be able to deliver interactive care plans for a person's health based on that risk score. What we're doing, and you'll see this in the demo in a second, we're able to allow a patient, or a physician could do this as well, of course, enter their CKM stage, their personal data. From that, they get a comprehensive risk score, an action plan. From there, they could actually select from one or more care plans, including a few of the AHA care plans, and then they're monitored over time. So this means that we're going all the way from a risk score to actual action, and then we're able to close the loop and figure out how well that patient's doing 3, 6, 9, 12 months from now. And of course, we're matching folks to a particular AHA care plan. I'll show you a blood pressure example in a second. But every piece of the action plan is something specific, actionable, that we're actually trying to get them to do. So I'll go on to the live demo. Bear with us as we're trying to play a video here. But Rachel will do this from the back. And I've been recording.
It's demo time. Welcome to Porter Health's Thrive platform. I wanted to demo how our platform works for 1 or 2 users in this quick time that we have. I'm going to pick Sarah Johnson and sign in as her. Now, for the purposes of this demonstration, assume that Sarah's health data, her health profile, including labs, personal information, has all come into this platform either from her EHR, from an integration with a mobile app, let's say such as Apple, using their HealthKit interface, or a direct integration with their EHR provider. So Sarah, when she logs in, she's already done all this work to get her data in, and we welcome her back and tell her how her risk assessment stands in terms of 3 AHA frameworks. 1, CKM staging, 2, prevent risk scores, and 3, life essential aid. If you go down through here, tell Sarah how she's progressing through her health journey, but if you look at the CKM stage, it's stage 2. Look at her detailed assessment, you'll actually see that she's higher BMI and also has the beginnings of hypertension. Throughout all of these sections on CKM, prevent, or LE8, there are actually videos that Sarah could watch to understand what this actually means, and these are AHA videos. On the prevent score, her risk is actually at 0.6 over 10 years or 4% over 30 years, so relatively low. But we can look at why that assessment is, again, the factors that went into it. Or we can go straight and look at her LE8 score, and here's Dr. Lloyd Jones explaining the LE8 score. We're actually looking at physical activity, sleep, tobacco status, and the like. And here again, you can see because of her BMI, blood pressure, and the fact that also there's no diet data in there, her score is not necessarily as high as it could be, but it's relatively good. We go to Sarah's care plans. This is where we provide a personalized care plan that also allows Sarah to enroll in an AHA care plan. We tell her what her current health status is, including some of the key findings on CKM, risk and active conditions like hypertension. We try to tell her why this matters in as simple language as we can. And then we tell her what she should do about it, or what we suggest she does about it. And one of those things is enrolling in a high blood pressure care plan. So we can actually browse plans that are available. These are the 4 AHA care plans that are available. 3 of them are grayed out because she's only eligible for the high blood pressure plan, the details of which appear in here. And she can choose to enroll in this plan or not. Now moving on to a bit of a demonstration of our mobile app capability. So this is an iPhone running the Porter Thrive app. We're actually going to log in as a different patient, Robert Martinez. Note that similar to Sarah, you actually have an assessment of Robert also on those 3 frameworks, CKM, prevent, and life essential aid. Turns out that Robert's also stage 2, however, with much different data. His body mass index, waist circumference, blood pressure might be high, similar to Sarah, but he also has high blood glucose, triglyceride levels, low EGFR, so some compromised kidney function. Prevent, which actually looks across all of those dimensions, results in much higher scores for Robert, 14.8% for 10-year total risk and 37% for 30-year total risk. And then in the life essential aid scores, there's actually, again, significant differences between the 2 individuals. I'm going to go to Robert's care plans. So again, a personalized plan, the ability to enroll in 1 or more of the AHA care plans is similar across the 2, but for Robert, one of the things is there's just more conditions and more action that's required urgently, right? So one of the things to point out is CKM stage 2, higher risk, more conditions. Of course, we're educating Robert along the way, but more interventions. Need to think about a smoking cessation program. You can certainly enroll in the high blood pressure care plan, need to change diet, think about exercise, weight loss, limiting sugars, and then of course talking to your doctor and considering medications to actually bring that blood pressure down. We go into the ability to grab care plans. Again, Robert could enroll in one of these, and maybe we'll go through that process now. So I'm going to confirm enrollment, and you can see right away he's successfully enrolled. This takes us back to Robert's care plans. Now he's actually enrolled in the AHA care plan for high blood pressure. You can see the date. So the date this was recorded was last Thursday, October 30th. Going to view activities, and you immediately see sort of a full 12-week plan, so covering 84 days, lots of activities on each day. I'll just show you a couple of them. So for example, day 1 has an assessment plan for blood pressure. If I click on that, I'm able to see questions which I could respond to if I were Robert, or things like videos to be able to see some AHA content, be able to, for example, understand how to take a blood pressure reading.
Talk about blood.
And that in a nutshell is how this all works.
All right. So I think we're way over time. Somehow that might not have been fast enough, but
That's totally fine.
Yeah.
You just come here, and Seth, if you have any questions, I think we have 2 minutes. I
Okay.
wanna make sure we
Well, first of all, congrats again on being a finalist here, and it's really exciting to see you trying to take the evidence to action and bring together multiple frameworks, including the CKM framework and Life's Essential Aid and the Prevent score. I have multiple questions. I think I'll focus. I'd like to learn a little bit more around, from what I saw, the clinician component. So what I saw seems very patient-facing and activating patients, educating patients. How do you see this tying together with the clinician? Like, are you interacting at all with the clinician? Are they using this tool in any way? How do we drive that collaboration? How do you see that best happening?
So certainly what you saw was very patient-facing, but in the back, how that data comes in, ideally it would come in mostly from their EHR with a few pieces missing, right? So that's a FHIR integration there. And then everything would be written back saying, here's their full report, right? Here's their prevent score, here's their CKM stage, here's the and here's the things we've recommended, right? And we'll go back. So that's how that loop, we intend that loop to close.
Thank you.
Thank you. Sorry, folks. I didn't want to bring in my old New York Harlem days where I'm like brooming people off at all. So I'm a little bit more conscientious. But congrats again to Porter Health. Our second winner and finalist is OneVillage. Again, please, folks, 5 minutes. I'm sorry. Okay. Sorry about that. A bit of a change of plans. We will have Conneqt. Sorry, Conneqt. Is there a representative? Okay, perfect. That's fine. Yeah, go ahead.
Hello, I'm Assissi, Product Marketing Manager at Conneqt Health. At Conneqt, I need the clicker, sorry. At Conneqt, we're transforming cardiovascular care by making it both personal and measurable. We do that through technology that captures what's happening inside the arteries and connects those into real-world change. Over the next few minutes, I'll walk you through the problem we're trying to solve, what we built, how it scales through AHA care plans, and how personalization strengthens it, and how we measure impact and equity. So let's get started. I don't know what to do. There we go. Okay. So every year, millions of Americans receive AHA guidance, but only a fraction turn that guidance into lasting change. Too often, cardiovascular care stops at advice. Patients leave appointments informed, but unsupported. And clinicians rarely see what happens between visits. They wonder, did the plan become a routine? Did it change outcomes? At Conneqt, that's the gap that we solve. For adults managing hypertension, heart failure, cardiac rehab, and overall risk, and for the clinicians who guide them, our goal is simple: make AHA science actionable, visible, and measurable in everyday life. Ultimately, it's about turning trusted guidelines into habits that last. To close that gap, we created guided wellness programs, a new way to deliver AHA science as short, daily, measurable actions. The foundation is the Conneqt Pulse, which measures both central and brachial blood pressure, and it provides insights into cardiovascular trends. These insights sync automatically to the Conneqt app, where users engage with guided wellness programs built on AHA content. Each program combines one short article from AHA, a simple task, and weekly reflections to connect education to behavior. Our first program, Healthy Heart Essentials, is built on Life's Essential 8, and it helps users lower sodium, move more, and track their progress each day. It's a simple, repeatable framework that turns trusted science into daily habits with measurable outcomes. So Healthy Heart Essentials prove that the framework works, and so now we're scaling it across AHA's priority care plans. Each care plan builds on the same behavioral framework that powers Healthy Heart Essentials. So in our blood pressure care plan, participants log readings through the pulse, complete sodium reduction challenges, and see weekly trends. In our heart failure care plan, participants track weight and symptoms, reinforce medication and diet adherence, and receive targeted education. In our cardiac rehab care plan, users follow light activity prompts like walk 10 minutes a day, and record how they feel after exercise and build confidence through recovery milestones. Our next step is personalization. Prevent connects long-term cardiovascular risk scores to individual goals inside the Conneqt Health app. Users begin with self-explorations, habit-building journeys that expand on their 28-day care plan. They're guided routines that focus on sustainable habits like moving more, reducing sodium, and improving sleep. As weeks progress, the weekly review summarizes streaks and completed goals so users see their consistency pay off. And this is how Prevent turns long-term risk scores into short-term measurable actions. So we measure impact through both behavior and physiology. Engagement data from the Conneqt Health app shows how users complete daily tasks and interact with guided wellness programs. Next, we'll layer in habit adherence, confidence check-ins, and SMART goals. For example, logging blood pressure 5 times a week. Participants and clinicians can track progress through cardiology reports like this one, summarizing key cardiovascular metrics. And future versions will add prevent-based summaries and a clinician dashboard that highlights progress. And throughout, we'll design for equity with plain language lessons, infographics, and multilingual content so AHA science reaches everyone. This is how we make AHA science actionable, equitable, and measurable. Thank you.
Congratulations again, Conneqt, and I'll have my good friend and colleague Tatiana ask questions.
Yeah. Thank you. Beautiful presentation. Congrats. The question I have very similar to what Seth asked previously. So it seems to me that there is some playback to a clinician, and based on all my experiences working in healthcare, if you add another app or screen or paper, they have to look that's not integrated within EHR, that will not happen. So can you put a comment in place on how it will be integrated within the physician workflow? Because you definitely need to have a loop in a healthcare provider.
Sure. So currently our cardiology report that we have right now will implement the Prevent calculator, and we'll be having more reporting on this cardiology report. And on that report, right now in our app, you can share that report with your physician. And so the physician can see all of the patient's parameters over the last month, or potentially even like the last 3 months. And then obviously that could be uploaded to the EHR, and they could reference our report that way.
Yeah, I hope that you will be able to provide tighter integration without those extra steps.
Sure.
Not,
Yeah.
the physicians just
We
don't
would love
have time
to.
for
and
that.
we do have a portal, but it
Okay.
doesn't yet currently sync
Right.
that way with the Conneqt app.
Yeah. Good luck.
All right, thank you.
Congrats again. And last, but by no means least, OneVillage. All right, round of applause. And you could use this or this, which would you prefer? Okay, all right, let me turn it on for you. Perfect. You're welcome.
All right, let's advance one slide here. Hi, I'm Ashley, the founder and CEO of OneVillage. We virtualize supportive care, which is defined as the emotional, practical, and logistical support that wraps around core medical care in order to improve outcomes and quality of life and to lower costs throughout the rest of the health system. Our platform offers medical scheduling, insurance and financial navigation, and on-demand access to licensed providers in more than 35 categories, including physical therapy, mental health, sleep, and nutrition. Today, we're sold predominantly as an employee benefit through channel partners like Marsh, Cigna, and One Digital into companies and organizations like the United Nations, Custom Inc., and the CFP Board. In 90 days, we'll begin billing commercial insurance and CMS for our services, enabling us to offer them free of charge to individuals and through health systems. Thus far, our experience within employee populations has been incredible. We've generated a 97 Net Promoter Score, 2.5 times ROI for clients, as well as meaningful reductions in GAD-9 scores and hospitalizations across OneVillage populations. This equates to not only happier, healthier patients, but also potentially billions of dollars of savings if implemented and scaled through health systems and advocacy group partners like this one. Like most founders, my story is personal. I spent the majority of my career as a venture capital investor, most recently focusing on the on-demand economy. 8 years ago, I was diagnosed with cancer and found the system anything but consumer friendly. Even as an educated consumer, I struggled to find the resources and supportive care that I needed, and that was in a top 10 metro area. Later, as a daughter, I helped both of my parents pass away from chronic illnesses, including my dad from heart disease in South Carolina. And that's where I saw firsthand how deep the need for supportive care goes throughout our nation. OneVillage exists to change that. Our solution combines virtual cardio primary physicians, cardiac rehab, supportive care, as well as daily education and tracking to help improve outcomes and access to women's health across diverse communities. Okay, Rachel, can you cue the demo? Here we follow the case of Helen, a 35-year-old female pregnant with hypertension. Helen is interested in improving her outcomes based on interventions with lifestyle. Using natural language and AI, we're able to build a customized 80-day plan for Helen that combines AHA content as well as OneVillage licensed providers. At the core of our platform is cardio primary care delivered by women's heart health specialists. As we all know, women respond differently to medications and have different signs and symptoms, which makes this trained and proactive approach so effective. We're also able to highlight fellow portfolio companies like Acurai. Here, Helen can get access to a free blood pressure monitor and have OneVillage take care of all of the insurance details seamlessly in the background. The thing that I'm most excited to offer through this opportunity here is the option to do virtual cardiac rehab. By virtualizing these sessions and allowing them to be on demand and live at convenient times, we can finally allow women and individuals in underserved or rural communities to access what we know is already one of the most important and effective interventions in heart health. Outside of the clinical side of care, we also have Helen meeting with a number of different specialists like Yasmin, our doula here. Yasmin is there to help Helen to adhere to AHA's new clinical guidelines for heart health during pregnancy. At the end of every day, Helen has the opportunity to log in her medication as well as her well-being. That is all immediately translated into in-app reporting and trackers. Helen also has the ability to have custom labs drawn, like these, ordered by her cardio primary physician. Using our existing partnership with Quest, labs can be delivered through at-home blood draw kits or taken at one of hundreds and thousands of local facilities. These datas are all fed as they're received into critical calculators like My Life Check, so that doctors, patients, and researchers can always operate with the most up-to-date and personalized information. It's an incredible honor to be able to be a conduit for the life-changing, groundbreaking research you're doing here at AHA, and we're grateful to share our work with you today. Stay here for questions?
Yes. One question, and then we'll give awards, please. Erin, please.
Oh, congratulations on being a finalist. That's amazing. So I really like the idea of focused 80-day intervention for women that can be used around pivotal life transitions, such as postpartum after an adverse pregnancy outcome or menopause. And I think the website has a lot of visually appealing aspects, like these dashboards you showed with blood pressure trends and heart health scores, and the nutrition and the holistic support and the focus on multilingual ability for people with low literacy and the coaching. I guess some of my questions are with the PREVENT score. One of my concerns about PREVENT score, it doesn't have these female-specific factors like adverse pregnancy outcomes, like preeclampsia and early menopause. And how are you going to capture these female-specific risk factors and integrate in that care? And the second thing was just about the delivery model. I guess with the virtual telemedicine visits with the physician, that can be billed to insurance. But what about the cardiac rehab? I mean, I'm assuming that can only be billed if it has a rehab indication, like heart failure or post-MI, but what about around menopause or postpartum? I was a little confused about whether that kind of virtual program could help women beyond just the, financially reimbursed indications for cardiac rehab.
Thank you so much. There's a lot there. I'll try to get to as much of it as I can. The cash cow of this operation, the reason that we're able to monetize it, this is a completely unsexy industry and nobody wants to do it because it's been hard to monetize, but it's so critical, as I can tell you from personal information. What we've been able to find is that group billing is actually the key to monetizing it. The reason why is because we can do one-to-one billing for all the sessions, like with the doula and so forth. When I do a group session, I can bill 10 times 140 if it's a nurse, or 265 if it's a doctor. And so those group sessions, not only do they do amazing things, but they also provide quite a bit of cash profitably.
Thank you. Do not go anywhere. Pat, Dr. Dunn, please, I'd like for you, on behalf of the Center for Health Technology and Innovation, would like to acknowledge you for being this year's one of the winners in the CarePlan Challenge champion. So congratulations. Congratulations. Awesome. And we'll take a picture. Yeah. Okay. All right. Next, we'll call Conneqt. Is the representative of Conneqt still here? So, yep, here she is. Congratulations. All right, we're gonna do a picture. Yes. And next, Porta Health.
Awesome.
All right.
Okay.
And thanks again to our phenomenal judges, Seth, Tatiana and Erin, for your amazing work. And come back this time, next year, we're gonna have a bigger one, CarePlan.
And more time.
And more time. I did not say that. It was fantastic time. Thank you so much for having us. And have a wonderful sessions, folks. Have a wonderful day.